So process recording is a written record of a nurse of all that what happens during therapeutic nurse-patient relationship. So usually it is a educative tool or some therapeutic tool or diagnostic tool. It is used for studying the self effectiveness by the student nurse. Most commonly what happens is how I am in interaction with the patient, whether I was effective or not, whether I was productive or not, whether I was dealing with the issues properly or not, where I was wrong, what was wrong from my side. I need to correct myself after knowing my mistakes. So, all that can be studied by the student nurse by going through the process recording. So, process recording is nothing but it is a written record of all that what happens between nurse and patient. So, during therapeutic nurse patient relationship, whatever the nurse tells to the patient and whatever the patient tells to the nurse, all that verbatim is recorded in a systematic format that is known as process recording. Process recording. So, with what kind of a therapeutic techniques you are using to correct the patient's problems or to teach the patient something, or patient is having some maladaptive behavior, wrong behavior, you want to correct it, how you are correcting that behavior, or you want to teach something new to the patient, how you are teaching that. So, the way you are dealing with that issue, all that is recorded. Therapeutic techniques, what you are using to correct the patient's problems, all that is recorded. And at the later, inference, a scientific explanation, what is the end conclusion about the interaction, all that can be written. So, this format or maintaining the record of verbatim between the patient and the nurse in a written record is known as process recording. There are some definitions given here. They are, the first definition says that process recording is the recording of the conversation during the interaction or the interview between the nurse and the patient in the psychiatric setup with the nurse's inference. It is not interference, it is inference. So what happens between nurse and patient during interview? So patient is talking to nurse. So they both are sitting in one calm, quiet place. It might be a ward, or it might be a corridor, or it might be in a garden. So that you and your patient are going to discuss about some issues of the or the problems of the patient in a separate setting. So that conversation which takes place between the patient and the nurse in a specialized setting is known as process recording. Second definition is it is the written account of verbatim, a recording of all that transfer emerged during and immediately following the nurse patient interaction. So it is nothing but a written account of all that what happens between the nurse and patient during the therapeutic nurse patient relationship. You may keep on writing during the conversation, or otherwise you can make up points so that you can memorize later after completing the interaction with the patient. You can go back to your place, you can sit with a book and pencil, and you can enter all the information by memorizing, by recalling into the format. You can enter everything as and when, how it has happened, what all happened, what you said, what patient said, how you solved the patient's problem, how you corrected the behavioral abnormality of the patient, what technique you have used, what is your conclusion about the patient's behavior, how was the patient with you, was there a good rapport, was there a trust between you and patient. Everything will be systematically recorded in a format. That format is known as process recording. Process recording. Purposes of process recording. So there are some purposes why you are maintaining a record of interaction between the nurse and the patient. So the main purpose here is to improve yourself, the way you are interacting with the patient, the way you are talking to the patient. So, how your communication is affecting the behaviors of the patient, how you are dealing with the problems of the patient. So, whether you were effective or not, is there anything you need to correct yourself? So, to know all that, you are going to carry out a process recording. So, let us see one by one to improve the quality of nurse patient interactions. So, quality of nurse patient interaction. So, means what is the main purpose of establishing a relationship with the patient? It is to solve the problem of the patient. So, whether you are doing that purpose or not, so to check out that you are maintaining process recording. Next is to assess the student nurse to plan, structure, and evaluate the interaction in a conscious level. So, to make the student nurse understand about her behaviors in interaction with a patient, whether she was right or wrong, whether she was dealing with the problem correctly or not. So, everything to know about herself consciously what she is doing, to making her to interact with the patient in a conscious state. So, whatever I am doing, so I am doing it with a high consciousness, with high alertness to gain competency in interacting and synthesizing raw data, to make the student nurses perfect in collecting the data about the patient. So this process recording helps the student nurses to collect in-depth information about the patients, to understand the problems of the patient after collecting the information. So to help in this process recording helps, and to develop awareness about own habitual verbal non-verbal communication pattern and the effects on others. So how you are interacting with others, how is your communication pattern, so how your behaviors are affecting others, so what is the impact of your communication on others. To know about all that, your verbal and non-verbal communication, how it is affecting others in your mental health team and even other patients also. To know about all this, they maintain a process recording. And next one is to identify the thoughts and feelings in self and others. So, what kind of a feelings you have, to know all that, so they make you to maintain a process recording. These are all some of the purposes of maintaining the process recording in a psychiatric setup, to help the student nurse to know herself better, how she is in interaction with patient, whether she is effective or not, where she is lacking the skills. So any communication techniques are lacking. So if she comes to know about that problem, she can improve herself later. Even to know more and more about the patient's life history, to collect the information about the patient. So it works like education tool to student nurses. It works like a diagnostic tool, because in a process recording you are collecting the information and you are identifying the problems of the patient, you are recognizing the problems of the patient. So it is a diagnostic tool, and it is even a therapeutic tool, because this process recording also has a some relieving effect on the patient's problem. The patient, when he talks about his problem, there will be some release of tension from his mind, so that acts like a therapeutic effect. So this process recording acts like both educative tool, therapeutic tool, and diagnostic tool. So it works in three ways. So that is all the purpose of process recording, maintaining a process recording in psychiatric setup by a student nurses. Prerequisites for process recording. Let us see. So, what are all the requirements to carry out a process recording? One thing is physical setting. So, where you are sitting with the patient to carry out a relationship. So, that environment needs to be calm and quiet and safe. There should not be any interference from the third person. If someone is interfering again and again, there will be an interruption in the flow of thoughts of a patient. Patient cannot express his life story or his problems in clear. So once he gets interference, he forgets or he denies explaining it again for you. So it may affect your process of interaction with the patient. So for that purpose, physical setting needs to be calm, quiet and safe so that he can conduct a process recording properly. So you can conduct it process recording in a patient's room on bed, or you can call the patient into the separate room with a table and chair, or even you can conduct it in a corridor or somewhere in a garden also, but there needs to be a privacy little. There should not be any disturbance because the patient's mind may get diverted because of some stimuli. So for that purpose, calm and quiet environment is a requisite. And then next is obtaining a consent from the patient, because whatever the patient is talking, you are recording it on a paper. So for that purpose, you need to take a permission from the patient, consent, after explaining everything, why you are in interaction with the patient, what is the main purpose. You will explain everything to the patient, then you will take the consent of the patient. You can record the conversation also sometimes. With the permission of the patient, you can keep the recording. You can record all that what happens between you and your patient during process recording. That also with the patient's permission. If the patient is not willing you to record the conversation, you cannot do that. It is against the ethics. And then next is maintaining a confidentiality. Whatever the patient is disclosing to you in a conversation, don't disclose it to any third person. You can keep it confidential. Don't tell it to any third person, because patient trusts you, he believes you, he is disclosing all his personal problems. You should keep all that confidentially without disclosing it to third person. You can share the information within the mental health team, but not with the other people. So you have to hide all the information about the patient. That is a requisite to carry out a process recording. Next, let us discuss the outline of the process recording, how the process recording looks like, and what are all the contents of a process recording. Let us discuss that outline of process recording. So first thing, it includes the introductory material. Second thing, it includes objectives, what for you are conducting a process recording, what is the purpose, you will state it in objectives. And then a recording of all that interaction which takes between you and your patient. So writing work takes place in recording. And analysis, judging what is the meaning of the interaction, what has happened between you and patient. So you are coming to the conclusion. And then at the last, it is a summary. You are going to summarize the interaction between you and your patient. So this is an outline of a process recording. Let us see one by one. So what all that introductory material includes. So it is all about the patient's preliminary informations. That is description of the patient, like name, age, sex, educational status, health problems or length of stay in a hospital. So IP number, date of admission, address. You can write all the details, religion, caste, so area of living, rural or urban or educational status. You can write all that preliminary information about the patient. And then next you can write a date, time, place and duration of interaction. So when, what is the date of your interaction, time at which time you are conducting the process recording, a place where you are conducting the process recording, and for how much time period. Usually it will be for 30 minutes to 45 minutes maximum. So you will record all that time, place, time, place, and date and duration. All that you are going to record, and then recording of nurses' own thoughts. So, before entering into the process recording, how were how were the thoughts of the nurse herself? So, how is the feelings of a nurse? What is the emotional status of the nurse? So, the nurse is going to record about her own feelings, thoughts, and emotions before entering the process recording. And then last thing is why you are selecting the patient for process recording. What is the main purpose of selecting this patient for process recording? So you will write all these details in an introductory material. After writing introductory material in the process recording outline, you are going to write objectives, clearly stated goals, systematically, consciously, they are stated before going near to the patient for interaction. Before meeting the patient, you will formulate the objectives first. Why? Because if you have a clearly stated objectives, your interaction will be structured, guided, and those objectives will guide your interaction. You will not go away from the track. So you will not waste your time. All your interaction needs to be with some purpose. These objectives will guide you to go in the track to solve the problems of the patient. That is the main purpose of process recording. So, for that purpose, you need to clearly state the objectives. And even in this objectives, you will state short term goals and long term goals. You will state the long term goals. To achieve that long term goal, which are all these short term goals, you are going to state them all very clearly so that your interaction between the patient and you, whatever the interaction takes place, all becomes very much structured. You will not struggle to ask the question. You will not search for what to ask, what to do. So that question will not arise because everything is clearly stated and you know what to do when you are in interaction with a patient. There is no question of confusion, anything. It is very clearly stated in the form of objectives. Second part of process recording is objectives. First one is introductory material, second one is objective. So in the outline of process recording, first you will write an introductory material, next you will write objectives. After that you are going to write all that what happens between you and patient. That is verbatim, it is called as. So whatever the patient talks to you and whatever you are telling to the patient, so whatever you are asking, whatever the patient is responding, all that what takes place between the patient and the nurse, whatever you do, whatever the patient does, whatever you say, whatever the patient said to you, all that needs to be entered into the format very clearly without any intervention from your side. Don't edit from by based on your thoughts. You may forget or you may add something from your side to make it something different. So don't do that. Whatever has happened between you and your patient, record it as it is. Whatever patient has done to you, what you have done to the patient, what patient said to you, what you are telling to the patient. So because it is going to help you where you need to improve, it will help you in improving yourself. So I am lacking this skill, this technique I need to learn. So you will come to know after reading that process recording. For that purpose, whatever happens between you and your patient, as it is without any manipulation. You should write it in the format. So that is known as a third part of a process recording. First one is introductory material, second one is objectives, third one is recording the interaction between patient and nurse. Whatever the thoughts and feelings of a nurse and patient's overall response to your interaction, what patient said at the end, so all that needs to be entered, and non-verbal communications from the patient side and your side both needs to be recorded. What you are using the body language or a non-verbal way of communicating something, and what the patient is communicating with the non-verbal methods, all needs to be entered very clearly separately. There is a column: verbal communication, non-verbal communication, communication of a nurse, communication of a patient. So there are different columns you can enter differently. Analysis means what has happened, how was it, and what is the problem. So where we are lacking, all that you are analyzing the interaction between the patient and yourself. So what was wrong with you, what was the wrong with the patient, what patient needs to learn, and what you need to learn, how to solve the problem of the patient, whether you know it or not. So all that you will come to understand here in this analysis process. You are going to evaluate your performance in interaction with the patient. How was it? All that you are going to write it in this analysis. So usually the process recording goes for a 30 minutes, as I said you earlier, 20 minutes interaction and 10 minutes for recording. That is what you can write the conclusion, and you can plan for a next contact when you are going to meet the patient, planning for the next session. 10 minutes separate for that and 20 minutes interaction. So you will wish the patient, and you will go on asking some questions based on your objectives. To fulfill the objectives, you will frame the questions, you will ask those questions to the patient, and how the patient is responding, what he is telling, what he is showing the behaviors, all that you are going to write in a process recording. So 20 minutes for interaction, 10 minutes for conclusion, summarizing, and planning for next session, and even for writing work also. Next in the outline of process recording is summarizing what all has happened in the process recording. So that all in brief you are going to write, whether you have met the stated goals or not. So second step is stating the objectives. So what all objectives you have written, whether you have achieved or not, you are going to check out. So if you have not achieved the objectives, what is the reason for that, you are going to write clearly. So that all happens here in summarizing. So this is all about the outline of the process recording. Here is a format to write a process recording. You can use this format to write a process recording during your clinical post. All the details, preliminary information about the patient you are going to write first, and then you are going to write the objectives, and then you are going to record the interaction between you and your patient. See there are two columns: verbal response column and non-verbal response column. In a verbal response column, what nurse is telling you have to write in a nurse column, and what patient is telling you have to write in a patient's column. And about a non-verbal response, what the nurse is using, non-verbal communication techniques, what the nurse is using, you have to write in a nurse column. And what the patient is responding to you with a non-verbal communication techniques, that also you should write in a patient's column. And then next column is therapeutic communication technique. So which technique you are using? So you may be we all have learned some of the therapeutic communication techniques. So restating, briefing out, and asking the question, asking the clarification, restating. So there are many different types of communication techniques. So which technique you are using to solve the patient's problem? So that all you are going to list out here in this column. therapeutic communication technique, which technique you are using to solve the patient's problem. And then last one is inference, a scientific rationale. Scientific rationale means what is the justification, scientific reason for what has happened. You are going to write it there in that inference column. So this is the format of process recording. So I will brief out the process recording. Process recording is nothing but all that what the nurse is going to record in a format, whatever happens between the nurse and the patient in a therapeutic nurse patient relationship, all that is recorded in a systematic format, that is known as process recording. Process recording is an educative tool. It helps the student nurse to learn her behaviors, make herself effective in interaction with the patients. It helps in learning for a student nurse. That is why it is an educative tool. It helps the nurse to understand the problems of the patient in diagnosing the problems of the patient. So it is a diagnostic tool, and even it will help the patient to solve his problems in some extent, and it will help the patient to release his tension and to get rid from his problems. That is why it is having even therapeutic effect also on a patient. So it is a therapeutic tool. It will solve different purposes. That's all about a process recording. I hope it is all clear to you.